All right, we are back with part two of the female reproductive system. We're talking about getting your period or your menstrual cycle. So, typically, your period or your menstrual cycle will start around 10 to 16 years old. Typically, you can notice this starts about 2 years after you notice your breasts begin to develop. Some other key indicators would be the growth of pubic hair, and then also if you start to notice that you're having vaginal discharge. This is completely normal to experience vaginal discharge. It can be like a creamy white, like a thicker consistency of a discharge that comes out of the vagina. This isn't something that you can kind of regulate, like when you urinate. You can't really control it, so it'll just come out of the vagina. And so when you notice that, it sometimes is a good indicator that your period is coming soon. Your period or the bloody vaginal discharge will typically last about 3 to 7 days, and it definitely might not be regular at first. So it could take a little while for it to become regular. To understand kind of what's going on during your period, it's really important to know on the far right side of this slide, the photo of the uterus. So that's going to be the key organ that plays a huge role in why we have menstruation. So I like to start at diagram number 4, and this is day 1 through 7 of your 28-day menstrual cycle. Now I know I said 28 days. That does not mean you're bleeding for 28 days. This is just the 28-day cycle of hormone changes with your body that regulate your menstrual cycle or your period. So for about day 1 to 7 on diagram 4, that's when that inner lining of the uterus is shutting off and some of that blood and fluid and other discharges coming out. It's going through the cervix, out the vagina, out of the body through the vaginal opening. Again, this isn't something that you can kind of control like you can your urine. This will just happen. It just comes out of the vaginal opening. So for day 1 through 7, this is typically happening. Starting around day 8, the ovary starts to get ready to release one of the eggs. Around day 14, so in diagram 2, that egg is getting released or ovulation is happening. So roughly halfway through your 28-day menstrual cycle. So from day 15 through 28, that inner lining, it's also called the endometrial lining, is continuing to thicken and it's getting thick with nutrients in order to house a baby because that egg is coming through the fallopian tubes. And if fertilized by a sperm cell, then it would grow and start new life. But when the egg reaches the uterus and it is not fertilized, that's when you start all over at day 1 and you have your period and that endometrial lining starts to come off again. So this is just a little diagram of if the stars were the days that you had your period, so roughly 5 days, the little check mark is when ovulation would be happening. So that star on day 4 or Monday the 4th, you'd count 14 days from that is the check mark. And then 14 days after that, you can anticipate your period starting again. Menstrual cramps, unfortunately, sometimes come along with your menstrual cycle when you have your period. You can do things like exercise, take a warm bath, use a heating pad, but make sure it's no longer than 15 minutes. And always check with an adult or a grown up in the home before taking any medication like Tylenol or ibuprofen. These are totally normal, they happen. Some women experience them much worse than other women, and some women don't even experience them at all. So if you're having trouble with severe menstrual cramps, please talk to the grown-ups at home or talk with your doctor about things that you can do to help that. All right, next one is going to be male reproductive system.